Our students of Dentistry 40 class, Assalamu alaikum wa rahmatullahi wa barakatuh. We talked in the previous video about the extraoral appliances and the intraoral appliances as well. As we said, these types of appliances are considered as the orthopedic appliances or appliances that induce the growth modifications of the jaw. In case the myofunctional appliances, they improve the growth of the lower jaw forward by its protrusion. In case of mild to moderate class 2 skeletal discrepancy due to mandibular retrusion. While in case of extraoral appliances, they are indicated in mild to moderate class 2 skeletal discrepancy due to maxillary protrusion rather than the mandibular retrusion. Also, the extraoral appliances they can produce forward forces in case of Delier mask, so it is called reverse pull headgear rather than backward pull headgears, as we said in these types of appliances. Each one of these appliances have its advantages and disadvantages, and their indications and contraindications. Today we will talk about another most important appliance, which is called fixed orthodontic appliances. These types of appliances in general are most effective and powerful, as it can be used for treatment of most cases of orthodontic problems. Fixed orthodontic appliances are devices that are attached on the tooth surface by using an attachment, and the forces are transmitted to the tooth surface by using an arch wire or the auxiliaries. As you see here in this slide, the attachment is the brackets, and the arch wire is the main controlling force that transmits the force to the tooth and later on producing tooth movements, which is considered as the main active components of fixed orthodontic appliances. The fixed property of such orthodontic appliances is the main features of fixed orthodontic appliances, because it can achieving continuous type of force rather than intermittent forces, as in case of removable orthodontic appliances. However, such a property having different disadvantages in addition to their different advantages. We can talk about it later on in the next slides. Starting with the advantages of fixed orthodontic appliances. As these orthodontic appliances or devices attached to the tooth surface, so the retention property commonly presents no problem, because the appliance is already attached to the tooth surface and not subjected to withdrawal or slippage from the patient mouth, as in the case of removable orthodontic appliance. The other advantage is less skill is required from the patient in the management of the appliance. There is no need for removal or insertion of the appliance within the patient mouth, as in case of removable orthodontic appliance. The other advantage of such type of appliance, it can provide multiple type of tooth movements in the same or in different direction with a precise control. هاي ايش يعني يا طلاب؟ هاي النقطة الثالثة، انه ممكن المريض من يلبس الفيكست اورثودونتيك ابلاينس ممكن راح يصير عندي labial movement, lingual movement, extrusion, intrusion at the same time. لكن بالremovable orthodontic appliance بما انه انا عندي مشكلة بالretention of the appliance، فمن راح اسلط force on different teeth ممكن راح يصير عندي withdrawal or slippage of the appliance. ليش؟ لان الretention عندي عندي بمشكلة او within the patient mouth. فلذلك بالفيكست orthodontic appliance بما انه الابلاينس retentive او fixed، فممكن راح اسلط اني force on the different teeth، فذاك راح يصير عندي عندي مثلا labial movement, lingual movement, extrusion, intrusion. فهذا يعني لك provide multiple type isolated، يعني كل توث على حدة of tooth movement with a precise control أنا مسيطر عليه. ليش؟ لأن هو fixed كامشة أو مسلط عليه force وبصورة جيدة bonded ما ممكن انه tooth يفلت from the arch wire، فلذلك شنو اقدر اسيطر على التوث. بنفس الوقت other advantages of such type of appliances it can provide any type of tooth movement، يعني مو مثل ال removable orthodontic appliance فقط tipping and rotation less than 90 degree. هنا بالفيكس appliance it can provide any type of tooth movement، وانتم تعرفون انه شنو التايب of tooth movement شنو هما، التيبنج tooth movement، الروتيشن، any type of rotation طبعا less than and more than 90 degree. Also extrusion intrusion difficult to be achieved by removable orthodontic appliance. Also torque tooth movement difficult to be achieved by removable orthodontic appliance. So such type of orthodontic appliance provide any type of tooth movement from the simple type to the more controlled or complex type of tooth movement which is called torque tooth movement. So these are the common advantages of fixed orthodontic appliances. So what are the common disadvantages of fixed orthodontic appliance؟ طلابنا مثل ما جاي يشوفون هنا when the appliance is fixed within the patient mouth and difficult to be removed, so there are different disadvantages. هنا the most common disadvantages of fixed orthodontic appliance اللي هي تكون شنو oral hygiene. دائما most commonly when the patient difficult to achieving good oral hygiene throughout the treatment of fixed orthodontic appliance, so there are different problems within the patient mouth. مثل ما جاي تشوفونها أعلى الصورة جاي يصير عندنا شنو there is a periodontal support affected and there is a gum recession, there is a caries production, there is a destruction within the tooth structure. كذلك جاي يصير عندي gum inflammation, a bleeding from the gum. كل هالمشاكل من جاي تجيني من البور oral hygiene. فلذلك لازم المريض يحقق لك good standard throughout the treatment of fixed orthodontic appliance. Otherwise there are different problems. يعني ممكن المريض يجينا بمشكلة واحدة اللي هي ممكن rotation within the central أو increasing within the amount of overjet، يعني يجينا شنو بمشكلة واحدة اللي هي orthodontic problem، لكن at the end of treatment there are different problems at the end of treatment، يعني ممكن راح ينتهي بكاريز production، periodontal diseases، mobility within the teeth، كل هاي المشاكل اللي هي تكون due to poor oral hygiene. فلذلك راح تكون عندي شنو certain limitation. Not any patient are indicated for fixed orthodontic appliance. لازم يكون المريض well cooperative، لازم يكون المريض well motivated patient، كذلك provide good standard of oral hygiene، ولازم بنفس الوقت المريض انه يعرف التريتمنت تايم، ممكن الابلاينس يطول لي من سنة حتى الى 3 سنوات. كل هاي الليميتيشنز لازم تخليها ببالك قبل لا نسوي insertion of fixed orthodontic appliances. المشكلة الثانية اللي يسويها الفيكس appliance اللي هي affect on the aesthetic because the appliance most commonly is made or fabricated from the stainless steel. All these types of appliances are affect on the aesthetic. كذلك skill is required but here not from the patient but require a specialist to insert such type of orthodontic appliance. كذلك الابلاينس يكون expensive. هنا chair time مو مثل الريموفال appliance، هنا يكون more chair time. كذلك Anchorage the most common disadvantage of fixed orthodontic appliance هو دائما احنا نواجه مشكلة بمن بالانكورج، مو مثل الريموفال orthodontic appliance. In case of removable orthodontic appliance, the teeth and the palatal mucosa or the lingual flange in case of the lower arch, these are the common sources of anchorage. يعني بالremovable orthodontic appliance الانكورج have two sources من التيث ومن palatal mucosa in case of the upper arch, while in the lower arch in addition to the teeth the lingual flange or the lingual mucosa. يعني التيث والبلاتال واللينجوال ميوكوزا هم source of anchorage، يعني عندي good source of anchorage، ما عندي مشكلة بال unwanted tooth movement. لكن هنا بالفيكس ابلاينس مثل ما جاي تشوفون هنا عندي هنا الابلاينس when bonded on the tooth itself، يعني tooth هو source of anchorage، يعني ممكن راح يصير عندي unwanted tooth movement. الانكورج مو بذاك القد، وانتم تعرفون الانكورج هو ال unwanted tooth movements after we apply an active forces. For each action there is a reaction. فلذلك من يكون الانكورج ويك جاي تشوفون هنا اسفل السلايد جاي زي مخلين شنو مثل هذا المؤشر عليه بالسهم الاحمر، مخلين من سكرو، مخلين البرغي بالبون حتى شنو لا يصير عندي unwanted tooth movement بهاي البوستيريور سيجمنت فورورد. ليش؟ لأن جاي أسوي ريتراكشن باكورد، أنا عندي هنا انكريز بالأوفر جيت، جاي أسوي ريتراكشن باكورد. وبما أنه أنا عندي الانكورج فقط من التيث أستعين بأنذر انكورج ديفايسز either by using mini screw or transpalatal arch or by bonding the 7 in addition to the 6. فكل هذه حتى شنو أزيد الانكورج. فلذلك most common disadvantage of fixed orthodontic appliance is anchorage, while the anchorage in case of removable orthodontic appliance is having commonly good anchorage. So what are the common indications of fixed orthodontic appliances? In general, most of these indications can be considered as contraindications of removable orthodontic appliances because they are difficult to be achieved by the later appliance. Starting with first, mild to moderate skeletal discrepancy in anterior posterior direction or in sagittal direction, but here in adult rather than growing patients, because when the patient is growing, commonly they are indicated for myofunctional appliances or the extraoral appliances or headgears to achieve growth modifications of the jaws. The other indication, intrusion and extrusion, or apical tooth movement and occlusal tooth movement or incisal tooth movements. When there is a severe rotation, when there is a rotation of the tooth more than 90 degrees, so such type of tooth movements is difficult to be achieved by removable orthodontic appliance. The other indication, overbite and overjet reduction. And the last indication, commonly fixed orthodontic appliances are indicated to achieve multiple as well as isolated tooth movements at the same time, either in the same or in the different directions. So all of these indications are indicated for fixed orthodontic appliances rather than the removable orthodontic appliances. And these photos represent the indications of fixed orthodontic appliances. طلاب مثل ما ذكرنا بداية الفيديو إنه there is a contraindication for fixed orthodontic appliance. Not any patient coming to your clinic is indicated for fixed orthodontic appliance. ليش؟ لأن دول الأسباب قدامي. من يكون المريض poorly motivated or less attitude patient، هذا يؤدي إلى شنو؟ poor cooperation or less of cooperation between the specialist and the patient. وبالنهاية this will lead to lack or failure of treatment of fixed orthodontic appliance, especially when the patient's having poor oral hygiene. Also, fixed orthodontic appliance not indicated for severe cases of skeletal discrepancy and in any direction, either in the vertical direction, in transverse direction, or in anterior posterior direction. ومثل ما جاي تشوفون هنا بالصورة إنه المريض عنده severe skeletal problem within the mandible. So this case is indicated for a method which is called orthodontic surgery. So most of these or all of these considered as a contraindication of fixed orthodontic appliances. Fixed orthodontic appliance in general pass through different stages to reach the nowadays used fixed appliance. يعني احنا حاليا الفيكس ابلاينس هو مو نفسه اللي كان يستخدم في السابق. بداية القرن التاسع عشر كانوا يستخدمون اي ارش او يسمونه اكسبانشن ارش. من اسمه كانوا يعتمدون على الاكسبانشن، يعني يجيبون هيفي جيج واير وبنفس الوقت يكون wider than the arch itself. من يكون الواير الرئيسي اللي مخلينه wider than the arch itself أكيد راح يسوي لي tipping tooth movement، وبنفس الوقت راح يسوي لي wide yard arch. من يعطيني wide yard arch أكيد راح يصير عندي alignment. بعدها اجى الابلاينس الثاني اسمه pin and tube. من اسمه طبعا اكو pin مثل ما تشوفون هنا اعلى السلايد على اليمين. هنا خلي لي pin يحصر لي الارش واير على الباند itself، فسموه pin and tube لحد ما وصل الى الإدج وايز ابلاينس من اسمه إدج وايز. هنا مثل ما جاي تشوفون السلايد اللي above edge wise appliance يكون الارش واير داخل لي شنو incisally، لكن هنا مثل ما جاي تشوفون الواير داخل لي horizontal، يعني بدل ما كان ينزل occlusally او incisally هنا جاي ينزل الارش واير جاي ينزل او inserted horizontally within the bracket itself، فسموه edge wise يعني شنو rotation باتجاه الإدج 90 درجة. All of these appliances are invented by Edward Angle، واحنا هواي حكينا على أنجل اللي هو يعتبر ك father of orthodontic specialty. يعني هنا طبعا صراحة إلى الفضل الكبير للفيكس appliance اللي هو حاليا احنا جاي نستخدمه. بعد الإدوارد أنجل اجاني العالم بيك، خلالي او سوالي البيك appliance. هذا البيك appliance is a modification of a ribbon arch. يعني شنو هو هذا الريبون arch؟ اصلا is an appliance of angle، فلذلك اجى من خلال modification مثل ما جاي تشوفون هنا هو نفس الابلاينس of Edward Angle، لكن الارش واير instead of inserted occlusally او incisally خلاه يدخل لي شنو apically او gingivally، حتى شنو يعطيني well control of the root itself. يعني شنو قدر الامكان حصل torque tooth movements. Whatever the type of these types of these initial appliances, the final tooth position is determined by wire bending. There is a need for wire bending to achieving final tooth position. يعني هنا من يكون المريض لابس the same brackets or the same bands for all the teeth anterior and posterior، أكيد راح أحتاج أنا شنو إلى wire bending. من أحتاج أنا wire bending راح يكون عندي شنو there is a need for time consuming. There is a need for well specialist. Not any dentist can achieve such type of wire bending. Also, the final tooth position is difficult to be determined, although by wire bending. So, the other type of appliances is required. To overcome the common disadvantages of these initial orthodontic appliances, Andrews in 1970 discovered the straight wire appliance, also called Andrew appliance. Andrews at that time found that the brackets itself can be used to determine the final tooth position rather than by depending on the wire bending, by saving the informations or the biomechanical information within the brackets itself. That is by using his keys of normal occlusion. As you see here in the lower part of the slide, that the brackets having an angulation or inclinations as well as labiolingual dimension. As you see here, that the brackets for the central incisor is different from the brackets of the canines or premolars, different from the old orthodontic appliances that having a passive brackets. That is mean the brackets of the central incisor is similar to the brackets of the canines and premolars. So such type of brackets having an built-in features. So such type of these appliances are considered as straight wire appliances or straight wire system. Why? Because there is no need for wire bending.